Good morning, everyone. Wanted you to see these root canals. This patient came to see me for endodontic retreatment of teeth number 29 and 30. He has no pain whatsoever. And he says these root canals were done, he doesn't remember exactly when, between 5 to 15 years. All right, so again, he has no symptoms whatsoever. Look at tooth number 29. Look how short the obturation is. Is that a periapical relucency here? Okay, look at tooth number 30. What is that? That's a missed root. The dentist missed the root completely here in the distal. No symptoms again, no symptoms, and I don't see a periapical relucency. Let's look at a different angulation, a couple of different angulations. Okay, so that's a different angulation. Take a look. Look at tooth number 29. I don't think that's a periapical relucency. Look at tooth number 30. Is that something there? Let's look at a different angulation. See, I don't limit myself to one angulation. I don't torture myself to just looking at one angulation. I look at multiple angulation PAs. Let's look at this angulation. Is that something? Again, I don't know, but look at tooth number 29. I don't see a periapical relucency. Another angulation. Again, take a look. Missed root. Right there. Look at that missed root. Let's look at this angulation. Again, I don't think number 30 has a distal lucency. Another angulation. Maybe. Take a look. We don't throw away x-rays, even though some of them are like this. And again, take a look. I don't see a periapical relucency on number 30. Maybe there is something here. Maybe on number 29. Maybe not. So what do we do in a case like this? The patient has no symptoms whatsoever, and these root canals were done 5 to 15 years ago. We leave him alone. We leave him alone. Just because a root canal was filled short, just because a canal was missed and we see it on the x-ray, these are not indications to redo root canals. Okay, now, if this patient was going to get new crowns, if the crowns were bad, yes, then I would recommend redoing the root canals. But right now, leave them alone. Okay, so this is one of the cases I worked on a few days ago. And let me tell you what happened with this case and why multiple angulation PAs are so important. Don't limit yourself to just reading one x-ray and you're struggling. You can't see what you're supposed to see, but you're just using all your brain power to just look at that one x-ray and to be able to extract what you want to extract from that one x-ray. You're limiting yourself so much. So, for example, look here. The roots of this tooth number 3, the roots were so long, I was getting my estimated working length based on the x-ray. The girls told me 21 to 23. I was at 27, 28 millimeters with the apex locator, and apex locator was telling me that I was short. And immediately, I didn't waste time, and I went to working length x-ray, PA. So that's one of the working length PAs we took. Okay, I'm at 28 millimeters and it looks like I'm right on. That's the mesial buccal 1. But I don't see the apex of my palatal root. What do? I just keep staring at this. And I send it to a buddy of mine who's an endodontist also, and say, okay, can you see the radiographic apex of the palatal root on this x-ray? And I stare at this x-ray and I look at it and I send it to other people. No, I don't do that. I don't do that. I just immediately take another PA, okay, another PA. And there it is. We took another PA and I'm short. So I was at 27 millimeters here. So my working length is probably 29. All right. So don't limit yourself to just looking at one x-ray and trying to and trying to extract every little bit of information that you need from that one x-ray. Free yourself, free your mind. Learn to take multiple angulation PAs. If I just relied on this x-ray for my MB canals working length and the palatal's working length, I'd be staring at this and questioning it for hours. I could, but we just took one x-ray and that's it. Take multiple angulation PAs. Now I'm 2 millimeters short. All right, so don't limit yourself. You guys sometimes limit yourself so much. You look at one x-ray. You take one x-ray and you want that one x-ray to answer all your questions. It just makes absolute no sense to me that you guys limit yourself so much. I was telling a follower of mine, she had the same issue, and she had one x-ray and she couldn't see the apex of the tooth with a file in it. She couldn't see it. I said, I told her, I said, endo is already challenging. Why do you make it even more challenging for yourself? You take a PA, you take a working length PA, and in that working length PA with your file in the canal, you can't see the PDL. You can't see the apex of the root. Okay? Stop torturing yourself. Stop sending that x-ray to me and torturing me too to try to make sense of it. Just take another x-ray. Take another damn x-ray. How hard is it to understand this simple concept in endodontics? You need multiple angulation PAs. All right?